Fibroids of the uterus, they're very, very common, and these are non-cancerous growths that can occur in and outside of a woman's uterus. Let's talk about it because they impact so many women. In fact, about 30% or 1/3 of women over 30 have fibroids. Again, they're not cancerous. They typically do not cause problems, and many women who have fibroids aren't aware of them unless they're pregnant or they're causing pain or bleeding. Fibroids are much more common in Black women, and we're not really sure why. So I want to show you what they are and describe how we diagnose them and how we treat them. So I brought my uterus model here, and I'm going to take it apart for you so you can see the inside of what the uterus looks like. So with a fibroid, these are, again, non-cancerous kind of fibrous growth of connective tissue that can occur anywhere, right? So they might be on a stalk like this, and I'm just using a little sticky pad to show you. They can be on a stalk and be outside the uterus. And so when we palpate it, we may feel a very irregular shaped uterus. And these can grow to be very large. I had a friend who had a fibroid that grew the size of a cantaloupe that had to be removed. Sometimes fibroids are just inside the muscle of the uterus. So they're just in the muscle. As the muscle grows, this is this hard fibrous connective tissue, and it may or may not cause any problems. Sometimes during pregnancy, with all that added blood flow, these will grow much, much larger and cause a lot of pain. There's also fibroids that can be found on the inside of the uterine lining. And these kinds of fibroids, when they impinge on the uterine lining here, can cause a lot of bleeding. As you can imagine, anything that interferes with the integrity of that lining would cause bleeding. So when a woman is diagnosed with fibroids, one of the first things that we do as healthcare providers is try to figure out whether or not they're causing a problem. And as I like to say, if it ain't broke, don't fix it. So many women can live perfectly normal lives, get pregnant, have babies, have intimacy without pain, and really not notice that they have fibroids. But if fibroids are growing, if they're getting too big, they may press on the bladder, causing a lot of bladder pain. They may be uncomfortable during sex and intimacy. If there's fibroids that are close to the cervix, if you have a large growing fibroid down here at the bottom part of the uterus near the cervix, they can interfere with a baby's head being able to descend into the vagina and a woman being able to deliver vaginally. As you can imagine, if there's a lot of fibroids in the muscle of the uterus, when a woman has her period and there's a lot of cramping, it can cause a lot of pain. It can also cause a lot more pain if a woman has fibroids in the uterus when she's giving birth and she's having uterine contractions. One of the things that is important to know is if there's fibroids here that are against the uterine lining or the endometrium, that bleeding can be so, so heavy. And many women with fibroids will bleed excessively. They may soak through all of their protection in less than an hour. They may find that they're bleeding like this for day after day after day. They may be passing large clots. And for many women who have heavy bleeding with fibroids, they may not be able to go to work. The pain may be so severe or the amount of bleeding so intense that they're not able to leave their house. If this is something that's happening for you, please do talk to your healthcare provider. If you don't have a gynecologist or someone familiar with women's health, you can go to an urgent care center. You can always go to Planned Parenthood because there are nurse practitioners like myself who are specialists in women's health who can help you get the care that you need. But when a woman has a lot of bleeding with fibroids, there is medication that can be used to help control it. So some women will decide to use the birth control pill or the contraceptive vaginal ring. and they can use it continuously. That is, they'll use the hormones every single day and skip periods. That can help them not bleed so much, not become anemic. Another way women treat fibroids is they can use a progesterone-containing IUD, such as Liletta or Mirena. Now, the IUD doesn't remove the fibroid, but what it does is it causes the lining here of the uterus to be very thin, so it's not going to bleed much anyway. Another medication that can be used to treat fibroids is called Myfembree, and this medication helps reduce the bleeding and the pain that women with fibroids have with their periods. Now, long term, if those solutions work for you, that's great. However, if fibroids are getting too big, if you're not having your pain or your bleeding controlled with those medications or the IUD, then do talk to your provider about whether or not you can use other ways to help those fibroids not interfere with your life or your ability to get pregnant if that's something you want. There is a procedure called a uterine artery embolization. We abbreviate it as UAE. So I'm going to kind of explain it to you here using my model. Imagine that you want this fibroid to shrink. Well, what do? You got to reduce the blood supply to it. And so using advanced technology, your gynecologist can determine which artery is supplying blood to that fibroid. And what they can do is put a very tiny clot into that artery, nowhere else in your body, into that artery, which will stop the blood supply to that fibroid. I had a patient whose fibroid was as large as a cantaloupe, and that was the treatment she used because she did not want to have the fibroid removed from the muscle of her uterus, and she did not want to have a hysterectomy. So another treatment is to have something called a myomectomy. Myomectomy means that an incision or a cut is made into the uterus and that fibroid is removed. Now that is done under general anesthesia, and a person needs to recover for a few days before they can get back to their life. Another treatment for fibroids, if they're small, if they're smaller than a walnut size, and they're impinging on the lining here of the uterus, only if they're doing that, is to have what's called an endometrial ablation. And that is a minimally invasive procedure that can be done as an outpatient without having to stay in the hospital overnight. And a small tube is inserted, and it removes the lining of the uterus and stops the growth of the fibroid and stops the fibroid from causing bleeding. Some women have fibroids that are interfering with their life, their lifestyle. They've tried everything under the sun to make it go away. And the only treatment that's really left for them is to use a hysterectomy. With a hysterectomy, the entire uterus is removed. And of course, that's major surgery, and that requires about 6 weeks to recover. So if you have fibroids, rest assured, they are almost never, ever cancerous. And if they're not causing you any problems, then you can monitor them with ultrasounds or examinations every 6 to 12 months. However, if your fibroids are causing a lot of problems in your life or your lifestyle, if they're preventing you from being able to get pregnant, or you're having severe heavy bleeding, do talk to your healthcare provider about all the options that are available to you. I know many women have family members with fibroids, and the only option that was available or offered to those family members was to have a hysterectomy. That's not the only treatment option you have available now. So don't let the fear of a possible surgery prevent you from talking about all the options that you can consider to treat your fibroids. If this has been helpful, please click like and subscribe, and leave me a comment about what you dealt with your fibroids, and also any other topics you'd like me to cover. Take care and be well.